Welcome, friends, and thank you for tuning in to another episode of the Optimal Health Program. Hope you're all doing well. Today we'll talk about a variety of things, some really interesting studies and articles about your gut and how it connects to your brain and affects your mood, with some hormone comments and neurotransmitter comments. Might be a little bit in-depth, but I'll try to make it easy to understand. We'll also talk about NAD, which is a super hot topic. Everybody's talking about NAD, so we have patients asking about it, calling for it. We'll go through the specifics of that. I wanted to talk about the first article and something that in research I initially laughed a little bit about, because the researchers, typically when PhDs and great researchers do their thing, they use abbreviations and you have to go back and forth into the little glossary of their abbreviations, and they try to make things as difficult to understand as possible. But they all understand this because that's their jargon. But at any rate, this is the title of an article in Science News, Science Daily, and it talks about dessert stomach emerges in the brain. So dessert stomach is discussed as a significant sensation where after eating a meal, you're craving more sweets and more sugar, usually created by sugar exposure. And what I've long thought and described for people is that when you eat too much carbohydrate during any one given meal, your blood sugar goes up, you release insulin, it knocks your sugar down, and then that low blood sugar sensation makes you want to crave more sugar or have more dessert. And the people that don't have the carb and have proteins and good fats and oils never get that situation. So dessert stomach. So the same nerve cells that make us feel full after a meal are also responsible for our craving for sweets afterwards. Again, depends on how much carb we take in. A group of nerve cells, so-called POMC neurons, are responsible for this. So in studies with animals and mice, when they are fed sugar, initially the sugar makes the mice or the person feel full, and then you're releasing beta endorphin, and that gets your body to want to have more sugar and to eat the sugar beyond your sensations of being full. So there's an opioid pathway in the brain that creates that desire for you to keep eating the things that you either don't want to eat or really want to eat, but are creating a problem for you because that just packs on more calories and more sugar. And that vicious cycle of sugar going up and down and such is something that, people have a hard time with. And most individuals don't feel good as a result of extra eating. They feel bloated, full, and they say, why did I do that? So there are ways to have things in your diet that are a little bit sweet, but not to create that aggravation and the misery afterwards. For so many people, I tell them that there are different options for foods, and there are ways to have, for example, a smoothie that will not give you any sugar, but it tastes good, and it'll satisfy your craving. For breakfast, a lot of people, and the recommendation typically is, if you like yogurt, you can get cashew milk yogurt. Whole Foods has it. Forager Project is the company that makes a really great cashew milk yogurt. It's 1 gram of carb for the plain yogurt. You can put some berries in it, and that tastes a little sweeter. So that could be your smoothie. You can put it in a blender. It's drinkable yogurt. And if you want to put in a protein powder, you're going to get 21 grams of protein. I use the organic protein, vanilla flavored. So you have this sweet tasting thing, but you're getting protein and really no sugar, no carb. So you can do that without it being an issue or a problem. And there are many other things and ways to do that, but that's one easy, and it's a great way to have either something like that for breakfast or to have it a snack between lunch and dinner or to have it for lunch. So there are ways that you can prevent all that sugar from coming on board. Overwhelmingly, in doing this forever, I've been a physician for 39 years now, and I've talked about the low-carb diet all of these years. If you keep the carbs tighter, you secrete less insulin, your blood sugar is more stable, you're not bloated, you're not exhausted after the meal, and so many good things happen that most people want to stay away from the grains and the sugars and the carbs. Then your body resets itself so that you're not starving all the time because your sugars aren't going up and down and certainly dropping too low. And you're able to stay within a reasonable range. I'm not saying you could never have it. For people that want to have some carb or some fruit, et cetera, I tell them have it around the time you're doing exercise. if you have it before the exercise, that sugar gets into your blood, your body, your muscles will suck it up as a fuel. Some people drink protein shakes before, some during the exercise, and some after. So whichever way you like to do it, I think if it's around exercise, your body has a much better ability to burn that sugar and make it less of an issue so that you don't have to worry about high and low blood sugars and craving and all of that. So very interesting scenario. But the majority of people that I see, overwhelming majority, when we keep the carbs tight, get rid of grains, people feel great. And I hear this every day from patients that I discuss this with. Usually at the first visit consultation, and patients tell me about stomach issues they have, we'll talk about, things that may be irritating their stomach. And it could be a variety of things. Could be infection, could be reflux, it could be allergy, etc. But I tell them right off the bat, cut out grains, cut out carbs, and then when we come back to go over your blood work, because we just drew the blood, tell me how you feel. Everybody says, wow, I can't believe my headaches have gone away. My congestion's gone. My bloating's gone. I'm starting to lose a little weight where I couldn't lose that before. My aches and pains in my joints seem to be changing, and people don't really understand it, but there's a lot that happens in your stomach that can control what goes on in the rest of your body. It's the doorway into your whole body. So the things that get in, if they're really good things, they'll make your body do well. If they're bad things, your body will do poorly. Phone lines are open, 1-888-420-9272, 888-420-9272 if you'd like to call in to ask a question. For those of you that would like to text or email or telepathically send some info to Frankie, he's ready and he's waiting. I was going to say we'll get him one of those antenna things he can put on his head, or maybe one of those metal triangle things. I remember going to a conference. I did a lecture years ago in the city. It was a gigantic conference. I'm trying to remember what hotel it was in. I think it was on Fifth Avenue. Big hotel, thousands of people over a couple of days. I mean, many thousands. And people were doing all sorts of different things, had all sorts of different recommendations. And there were people walking around with, triangle metal things on their head to try to attract energy and connect with the universe, I guess. I have no issue with that. I mean, as long as you're nice and you're peaceful and you're good to other people, you can do whatever you want. You can dress whichever way you like, so. But always interesting to see.
We have a question.
Yes.
Reddit, number 1. Hey, I'm 33 and I've been dealing with really bad headaches that seem to come on when the weather changes. I've heard people talk about barometric pressure headaches. Is that actually a thing, or could it just be?
It really is a thing. And I know the majority of people that have headaches or sinus issues or allergy will have discomfort when the pressure changes. And I'll go a further step to say, I know a lot of my patients that just feel irritable, angry, just not in a good mood when it's cloudy or rainy. And then when the sun comes out, and it could be a cloudy, rainy day and they don't feel good in the morning, and then the sun comes out and all of a sudden their affect completely changes and they feel great. And part of me likes to say that, yeah, I'm maybe one of those people as well, because I'm not in a great mood, but it's, rainy or cloudy and I can't go outside and do something. And certainly I've been that way, I think, since I was a kid. But if it's sunny out, you're ready to go and just, take on the world. So there's got to be some changes that occur in your body, whether it's the visual or the sensation you feel. A lot of people with sinus issues have pressure in the sinus, which will affect their head and their brain. So it's definitely a thing. There are comments as well talking about this topic. Seasonal affective disorder. Some people, when the winter comes along and they're not getting enough sun because they're all bundled up and they're not warm and sunny, laying on a beach, having a margarita or something equally as, nice, they're just, in a bad mood. They're either anxious, irritable, depressed. And of course, we have to check their hormones, because if testosterone is low, vitamin D is low, et cetera, thyroid, that can cause it as well. But looking at those individuals, if their vitamin D is low and you give them the vitamin D, all of a sudden that seems to go away. And you don't really see this phenomenon in the sunnier states in the South. And when people go from, winter in the north and they go down to Florida or the Caribbean, et cetera, to get some sun, well, of course they feel better because they're in the sun and it's a wonderful experience being on vacation. But the reality is you're getting more vitamin D. So I think vitamin D plays a significant role as well. There are some people that have headaches that actually have issues with their neck. So the way that their neck sits upon the top two vertebrae, the atlas and the axis, and the rotation therein, and ligaments and tendons holding you in position, there are some people that will have an abnormal position of their head on their neck, and maybe they sleep on too many pillows, maybe they're laying down watching TV on their hand and changing the positioning of the head. Once you evaluate that, stretch out, do some massage, and people can go for adjustments. I'm an osteopathic physician, so back in the day, Andrew Taylor Still, 100 plus years ago, was one of the first doctors to ever talk about understanding how the musculoskeletal system affects your entire body, because the nerves that come off of your brain, big fatty brain, and the spinal cord that comes down inside your spine branches to nerve roots. Those nerves go to your skin, your muscles, and your organs. If there's impingement or pressure on the nerve roots, whether from a disc or muscle or otherwise, you're not getting the same electrical signals to your skin, your muscles, and your organs. And this has been documented. It's pretty fascinating. When you first read about this, you're like, wow. But some cases, stretching and doing very simple adjustments will take that completely away. And we've seen it, and I've done it. But we want to understand the entirety of the background of the mechanism, because people that have allergies to trees, grasses, weeds, and molds are more susceptible to the environmental changes and pressure, because there may be inflammation in their sinuses based upon the allergy picture. That could also happen with foods. And when it gets wet and damp outside, and the molds go crazy in the environment, because they do, and your trees, grasses, and weeds are going to grow more, so that spikes it up even further. So that's why we have a breakdown of how these things occur, and we're looking for the underlying mechanisms for each individual. And one person, it's one cause, and someone else, it's a different cause, and some people, it's multiple causes. So that's why we look at the entire picture to get a better handle on it.
Okay, and we have this one. This is from Reddit as well. My son has been diagnosed with open lip schizencephaly. Probably botched that one.
Open lip schizencephaly.
Schizencephaly. And while we were working with his doctors, I'm looking into all potential options to help improve his cognitive and overall development. I've heard about stem cell therapy as a potential treatment for neurological conditions, but I'm unsure where to start or if it's something that could help.
Wonder how
with
old the son is.
Condition. Yeah, I'll get that. I'll try to get that.
Wonder how old he is. And what are the specific manifestations? So as a general comment on stem cells, because I've done it on patients for all sorts of different things, a wide range of different issues. Putting your own cells back into the bloodstream and then dripping it into your nostril to get to the back of your nasal cavity into your brain can do a terrific job at helping to repair damaged cells and make more neurotransmitters, because the stem cells become new brain cells, new eye cells, etc. And we've seen it for stroke, MS, Parkinson's, Alzheimer's. We tell people to look at the videos on the website for that. There are now and then certain rare things that we may not have experience with, but would like to get a better handle on the picture. Do you have an age yet or no?
No, I'll try to get that.
Okay, well, I can answer that a little bit better once we see, what we're talking about.
Yeah, we'll see if they follow up. We have another one. Hello, I have been frustrated with pains in both knees. One is a chronic knee pain because of minor cartilage thinning, and another one is a meniscus.
Meniscus
spread
tear.
up. Yeah, it's a tear which was just surgically repaired a few days back. I'm thinking of taking peptides first for about a month, in quote BPC 157, TB 500, and GHK-Cu, followed by stem cells immediately. Does this seem like a good plan, or should I have concerns?
So I like the fact that you're looking and learning and trying to find some great options as to what to do. But I can tell you, although I like the peptides, I think they're terrific. I love NAD, I love Sermorla and the IGF-1, et cetera. BPC is meant to have some anti-inflammatory effect. Whether it works for you or not, we won't know. There are some people that have tried both the oral and the injectable and have had no benefit. So I'm not going to rush to recommend something if a good percentage of the people that take it don't get the result. The others as well. So your body never really had those as a requirement in your system. So it's not as though you're low on BPC and you're taking it, and that's going to automatically do something to your metabolic picture. I'm not saying you can't do it, but the rationale behind STEM is that these are cells that are in your body moments before we take them out and spin them and put them back in. Your body always needs and wants these cells. It is the most dramatic and significant mechanism to create repair where there's damage, degeneration. You couldn't even put BPC in the same category as stem, because stem, when you put those cells in, they divide like crazy and become brand new cells of that damaged ligament, tendon, cartilage. And there's also, you can see on the website, pancreas, liver, kidney, heart, brain, every part of your body. So that by far is the greatest mechanism of repair. And that continues to occur over time because those cells divide. So, 2 cells becomes 4, 8, 16, 32, 64, and onward. They divide very quickly. So much so that when we extract the stem cell fluid and the bone marrow from the body, within a week or two, those cells are completely back to normal. So they divide that quickly. So you can't put anything else in the same category as stem. Although some people like the idea of PRP because they've heard that, and there's a PRP for your hair and your vampire thing. I'm not even going to use the word facelift because it's not anywhere near a facelift, but it's just a catchy term. PRP is taking 7 growth factors from your blood once it's spun. Our PRP is different because I use a stem cell centrifuge. It's 4,000 RPM speed. Typically, when doctors are doing PRP that have never done stem, you're using a regular centrifuge, which is nowhere near as fast, so you're not getting a lot of PRP. So PRP will last about a month, and then your body uses it up. It's not making itself and dividing on itself like stem cells do. So stem cell will be the first thing to do because you're putting that repair absolutely positively right to work. And those stem cells are becoming the damaged cells. And again, you could look at the videos on the website for brain-related disorders, heart, lung, organs, joints. So stem cells is always the first thing to do. There's nothing that you could do to get your stem cells to do a better job. They do their job. There's nothing that you need to prep them with, because even when stem are used for cancer with chemo and radiation, that doesn't negate the way the stem cells do their job to repopulate your cells and your immune system. So stem is always the first thing to do. Get those cells in there, create new for your brain, neurotransmitters, for your organs, other hormones and such, for your joints. You're putting new cells where the tear is. The others are theoretical, and you could use them. I just don't think you're going to see much of a change. Part of the issue, too, is that, especially after surgery, when they've cut certain tissues away, you want to have the new cells there to create repair for that surgerized area. And if you wait for that, you may be doing some walking around or movement and still having some grinding upon that tissue. So overwhelmingly in all these years of seeing patients that go for arthroscopy and they clean up or cut away, yes, that may take your symptom away, but it doesn't really necessarily make your knee more stable or strong. And it's interesting that research, and I'll have to pull that up at some point, to show that people that have arthroscopy are in many cases more likely to have a knee replacement sooner down the road because there's less cushion between the bones. So yeah, in first order is always stem. The others you could add on. Some people with heavy metal exposure say, well, should I chelate the heavy metal? You get your stem on board first, start the repair, and you could add those other things on secondarily.
And we do have a update on the first caller about her son. Said it's a rare brain defect that causes a cleft in the cerebral hemisphere. He is 6.
Yeah, so you may have to either contact Johns Hopkins and see what they're doing because they've got a vast pediatric facility. Stem cells certainly could be an advantage because you're putting new cells into the area, but I'm not sure what they're doing. I can't do that because the child's too young, but there's stem cell research ongoing worldwide. So I would look to a pediatric specialty facility to see if that's something that they're doing.
All right, then we got this pretty general question from YouTube. Is stem cell therapy pregnancy safe during pregnancy?
They're your cells. They're in your bones, so they're your cells. There's no chemical, no drug, no risk. Typically, we don't do it on pregnant women because, they may be a little bit uncomfortable doing the procedure, but we wait until they have the baby. It's just easier.
Got
Why give them more to deal with? Although the quick extraction takes a minute and a half, it's a little uncomfortable, and let them have the baby, let them be happy and comfortable. No reason why I couldn't wait to do that.
Fair. Okay, so we got a 48-year-old. This is on TikTok. Noticed that my vision is getting worse at night, especially while driving. My daytime vision seems fine, but I struggle more with glare and dim lighting. Is this just aging?
I wonder how old the person is.
Yeah, is 48.
Okay. So every time I talk to people and I see their vitamin A levels are low, I ask them if they have difficulty with night vision, because night vision issues are correlated with vitamin A deficiency. And, sometimes as I talk with patients, some say yes and some say no, but it's a pretty good number of people, probably 60, 70% of people say, yeah, I have difficulty with seeing clearly at night. Presbycusis, presbyopia are two different terms talking about hearing and vision changes as you get older. Not that your 40 is old in any way, shape, or form, but after a good eye exam, I want the eye doctor to tell me what your retina is like and what your vessels are like. So that's an important thing to look at. We always like to have other doctors give us the best, secondary information or opinion, like an MRI, or a vascular doctor give us some comments. So we take that all into consideration. But it could easily be a vitamin A deficiency, and it could be a vascular change in the eye. For some people, it could be change in neurotransmitters in the brain. But I would look at all that. Heavy metal exposure absolutely correlates that, because heavy metals get into your eyes just as they get into your brain, your heart, your lungs, and damage tissues everywhere in your body. So you want to look at all these things, and traditionally doctors just don't do any of that. And we've seen this. We've corrected vitamin A, and people say, wow, my vision's better. We've had some people who, interestingly enough, will have some vascular changes in their head, in their brain. And we've done MRIs on the brain for some people where other doctors may not have thought of doing that. If you see vascular ischemia, you're not getting enough blood flow with oxygen, vitamins, minerals, and hormones to your brain cells. So in that case, we may use stem cell. So it depends upon what we find as the underlying contributors, but we have to be comprehensive to find that.
All right. Redditor. Thank you, Reddit. I'm a 29-year-old. About 4.5 years ago, I had a ganglion cyst and a few bone spurs removed from my left hand/wrist. My cyst is back, and I can't describe exactly what, but my hand and wrist has never been the same. Would stem cell therapy help something like this?
Stem can decrease the inflammatory mechanism, but the ganglion cyst is something that needs to be addressed. It's not as though we can dissolve it. Historically, and these are interesting comments, doctors always have to tell a story. Well, you take a big book and you slap that ganglion cyst, put your wrist down on the table and smash it with a big book. That would break it up, but it would always come back. So historically it was either a Bible, because that was probably the biggest book back in ancient times. That's what they did. But if they're able to go in and remove the entirety of it, and that's the key, to remove the entirety of it, then chances are that won't come back. Scar tissue can form where surgery is done. And for some people, we've done stem cell therapy intravenously, and we've added, injecting to areas of scars or damage or post-surgical, and the stem can help repair that. But I have to look at the scenario and maybe get some testing done to really see what's going on within the wrist. Maybe nerve conduction tests to see what the nerve flow is like, maybe an MRI. So it's all about digging for information. I think I could have been an archaeologist the way that I think. Dig, dig, dig. And by the way, in my mind, I would have made a great archaeologist. And every time I watch these crazy shows about these guys digging for bones, either in Russia or in Oklahoma, I'm dying to go out there and do that one of these days and find some bones and fossils and some of these things. I had a friend, a girl who lived out in Utah for a while. Lovely girl. And she said everywhere she would go, she would just dig a little bit and find these little fish, skeletons in the shale and in the rock. She actually brought me one, which is pretty cool. But I love all that ancient stuff. So someday I'm going to start doing these things.
I'm not going to lie. I was trying to get the Jurassic Park theme song up in the background. I didn't get it on cue.
Yeah, we can try and do that. I saw something the other day, which is pretty cool. And I was on someone's Instagram, and it's a relatively well-known influencer, I believe, but there's a picture of her standing with Sinatra and the Rat Pack, like in a movie. It's like a movie scene, and Sinatra and the Rat Pack are there, and she's just standing in the picture. Like, how is she able to do that? You know, I've got to be able to put myself into some of these pictures because that would look really cool. Creative photography.
There we go. All right, we got TikTok. 51 years old. I've noticed that my skin is bruising more easily than it used to. I'm not on any blood thinners. I eat pretty well. Could just be aging, or should I get my blood checked?
Blood check for vitamins, absolutely. And your skin integrity is controlled by a variety of things. So vitamin C is important for your skin, just like NAD would be important for your skin, just like IGF-1, which is the active component of growth hormone, because it helps to make your skin more youthful. Bioflavonoids are really important for your skin. So it's not as though there's one thing, like a light switch on and off, where you take something and everything will change. Everything in your body is interconnected so that if you're correcting vitamins, minerals, hormones, if you go for massage, some people like to have skin treatments done. I think that's great. You know, hydrofacials are great, where they use water to put water all over your face and suck it out with a vacuum device. It's pretty cool. I've had that done. But your skin could be improved in a variety of ways. But, you know, we have to give your skin the nutrients it needs. We have to make sure your hormones are good, because that helps to control what your skin's doing. So it happens to everybody. So sooner or later, you want to have all of the components together at the same time to help to repair your skin, just like you would for your vision, your hair, any other part of your body.
Okay, we got one from YouTube. If I get stem cell therapy, is it an outpatient procedure, and what are the negatives?
It's absolutely an outpatient procedure, so it's all done within an hour. So depending upon what we're doing, let's say we're doing a knee or an ankle or a hip, patient comes in the day of procedure and lay down on the table. We lift the shirt up a little bit, pull the pants down a little bit so we could get to the crest of the ilium, this nice round little fat bump here at the bottom of the iliac crest. And we sterilize and numb the area, extract some bone marrow. It takes about 1.5 minutes, 2 minutes to do that. Spin it for a half hour. And then once the spin is done, the red blood cells are on top, plasma in the middle, platelets on the bottom, take them out. Stem cells at the bottom, rather. Take out the stem cells, inject the joint, and that's done within probably 45 minutes. If we're doing an IV, add 10 minutes onto that, because we're doing an IV with the stem in the IV, and that goes in 10 minutes. If we're doing a nebulizer for bad lungs, add 10 minutes onto that. And if we're doing the nasal approach, droplet, after the IV, that's 10 minutes. So it's all within an hour. Not difficult to do at all. What was the second part of the question? Was it outpatient?
And what are the
no downside.
negatives? Yeah.
They're your cells. So there's nothing negative that happens when you take your cells from one part of your body and then put them into another part of your body. And it's all done. They're put back in within the half hour to 40-minute time, because we're taking them, spinning them, and putting them right back in. That's the best mechanism by far. It's, state of the art.
Boom. And we have from Instagram, Dr. C, does your program work with MS?
Yeah, we do STEM for MS. You can look at videos on the website for that. We have a gentleman who's a really nice guy, gregarious, funny guy. He was a principal, a teacher, and he loved to talk. I remember when we did his STEM and he had a terrific result. He wanted to be on for like an hour and a half when we did the video. And we're like, I can't really put an hour and a half video on the website, but, he's just a great conversationalist. So he was in a wheelchair from his MS and couldn't use his right arm or legs. He had no stability. And when we did the STEM, and he was a rodeo guy. I remember seeing, and you could see on the video, I think he has pictures of him winning rodeos. He had a very, very strong hand grip and, very interesting past, very interesting history. And over time, when we did the STEM, within a day or two later, and he tells the story, he got up, got into his wheelchair from his bed, felt a little better, couldn't figure out what it was, got into the kitchen, sitting there with his wife. He went over, put water in the coffee machine, made coffee, put something in the microwave to eat, and then came back and was searching on his computer all with his right hand. And he didn't have any strength or ability to use his hand to do any of that. So the wife's looking at him like he had 3 heads. And he called me and told me, and I documented everything. It was wonderful. And then subsequently, he kept trying to push himself to get up out of the chair. It took about a month, maybe a little bit more than a month. And you see in the video, he's able to stand up out of his wheelchair. He didn't need to hold on to the rails because he had these big rails all the way throughout his house, because if he tried to get around, he needed to pull himself, and didn't need to pull or push himself up from the chair. He just leaned forward and stood right up. So it was one of the most dramatic things I'd ever seen. And this goes back probably 7 or 8 or 9 years or so, but terrific, terrific result. We've had other patients with MS, similar benefits. Neurologic degeneration stops, and they stay functional, and they gain more function. This depends upon the severity of it, how long they've had it. But yeah, you can see that clearly on the website.
That's crazy. So next one we have is, what do you offer at your office outside of stem cell therapy?
So great question. The original approach, the initial approach is that you come in, we sit down, I take your history, examine you. You may come in for high cholesterol. You may come in for back pain, headaches, a rash, allergy. It could be anything that people present to doctors for. We sit down, we discuss your symptoms, your progression, everything that's going on with you. And then I talk about doing blood testing to understand the underlying mechanisms behind that. And in 5 days, the blood work is back. We sit down within that week, and we start to make recommendations. So it could be changing your diet, taking food allergens out of the picture to help get rid of bloating or headaches or improve your skin, low-carb diet to help to bring down weight or burn down cholesterol, triglycerides. We may have people that have joint aches and pains, and we'll send off for an MRI, and we may do stem cell therapy for that joint. The list goes on and on. We do hormone replacement for patients, because part of what my training is a board certification in anti-aging medicine. And I got that back in the 90s. So we can correct hormones for men and women. For men, typically we may do a testosterone shot if their levels are low once a week for 3 weeks and see how well they do with that. Some people love that testosterone shot, and once we recheck them, if they stay at their 700, 800, sometimes 900 range and they work out like crazy, they feel like $1 million. Some of those patients will switch over to a pellet under your tongue as a maintenance therapy. Yet others want to do the pellet therapy under your skin, so we can put that, towards the love handles on your side where we put pellets in that'll last 5 to 6 months. So one treatment, 5 to 6 months, and your hormones are all set. We can do that as well for women. So it's so many different things. It never gets boring or difficult because there are just so many different things that people present with. Occasionally we'll have patients that have autoimmune disorders, and certainly stem cell works for lupus, rheumatoid, diabetes has autoimmune mechanism and components. So it could be anything. We have a lot of people coming in that have memory loss and brain fog. There's a device that's relatively new where we put a cap on your head and wires that go to a computer, and you do some tasking. It shows us the speed of your brain and predicts whether or not you're going to have some memory loss or move towards dementia or even Alzheimer's down the road. So there's a great evaluation there. We'll do chelation therapy to pull out heavy metals once we check them in blood and urine. So the list of things we do goes on and on. It's just a comprehensive medical nutritional approach, and then the modalities we use are based upon what we find.
Okay, we have this one from YouTube. My fiance has colitis. While he has it under control with Humira, is there any way stem cell could help or cure this?
Yeah, there's a terrific video on the website, a gentleman named David, and his story is pretty remarkable. And we have, if you watch his video, for 21 years he had it, and he was miserable. He couldn't go far in the car because he was worried about having an accident. He would go to one friend's house, try to get the other friends to meet there, go to his aunt's house, and I felt horrible for him when we first sat down and went over this. And we tested him for food allergy. A few things showed up that were foods that were bothering him. And by the time we got set to do the stem cell, he'd taken the foods out, felt a little bit better. When we did the stem, the day after, he said he felt his first normal evacuation in 21 years. Because it was erratic, it was driving him crazy, as you might expect or understand. And then since that, His function has been normal. He's been able to go and go on vacation and do all sorts of things. And he comes in every now and then, and he's done the stem cells a couple of times because he also wants to use it as an anti-aging mechanism to get brand new cells in all of his tissues and organs. And his family has some other interesting age-related changes, but he's on point. I love people that are super educated, intelligent, and, he's a principal, et cetera, or was, and, having conversations with people that are really driven to be healthy, are great conversations. And he's off his meds, and, he's doing brilliantly. One of these days I'll get him in here for an interview so he can, talk about his case. But you can certainly see it on the website, drcalapai.com. So I think between the allergy mechanism, autoimmune components, and STEM, that's absolutely the best immediate, but then also long-term benefit for colitis and bowel disorders.
Crazy. In a nutshell, this is Reddit. I have plantar fasciitis. Again, a producer.
Yep.
Producer. Didn't go to med school, so my pronunciations.
That's okay.
Plantar fasciitis, and it's becoming taxing. Would I be a candidate for stem cell therapy? Have you helped anyone?
Yes, stem would
with
be a great mechanism to create repair in tendons and ligaments that are damaged. So when people have the ligaments underneath the feet, the plantar fascia is connective tissue that are in and around those ligaments. And at the heel, and we don't have a foot here, I may have to buy a foot model, to show, but at the heel, underneath where those ligaments attach, when you have fraying or damage, that creates instability, and fraying and damage can occur anywhere along both ends, in the middle of the plantar ligaments and fascia. So in many cases, just putting the stem where the damage is based upon MRI, you'll have some pretty significant improvement. There are some cases that might do better with a little bit of a very small surgical procedure that we send out to the podiatrist for. But again, the MRI would give us that inkling as to whether they would need that.
Okay, we got a big one from Reddit. I'm a 41-year-old male diagnosed in 2023 with chronic schistosomiasis.
Schistosomia.
I mean, yeah, I'm getting,
Yeah, and you would never be able, no one would be able to spell that, yeah.
So.
It's a parasite.
So let me get through. Hold on one second. Okay, so contracted in 2010 while swimming in a lake in Africa. Although the parasites were eradicated with Presenquental, or I guess that's a shot.
Medication.
Yeah, their dead eggs have caused severe calcification and chronic inflammation. I'm experiencing a range of debilitating symptoms, including painful fibrotic lesions in my ribs, abdomen, and hips, ureteral stricture, thickened bladder walls, chronic intestinal inflammation, urethral lesions, and causing recurrent UTIs, herniated spinal discs, and persistent abdominal and symphatic abdominal.
Yeah.
This has been a long paragraph for me.
That's okay.
To make it a long story short, I'm considering stem cell therapy, and I'm curious if you have any advice.
So the fact that the medications killed the bug is one of the most important first steps. Now, a lot of bugs, parasites, will leave things behind, like they'll leave cysts, and they can leave some debris that your body could react to because it's foreign. So that's not unusual. The question with STEM is that, and certainly we've seen a variety of different circumstances where STEM shuts down an inflammatory cascade. It may very well shut down an inflammatory cascade that you're dealing with. We know that STEM shuts down the inflammation of lupus and rheumatoid, which are very constant and very pervasive. So I'd like to be able to see and understand the entire picture. I want to see what your immune response is doing. I'd like to look at heavy metals. I'd like to see your vitamins and hormones, but it may very well help for that. So it's hard for me to say without knowing everything about your picture.
We'll try to get we'll see if they respond. Wait on that. We have another one, YouTube. Are you going to get RFK on your podcast?
Oh, please.
See that one.
You know what? The more that people ask me, the more I think it might happen. So I
air.
would love to have him on the podcast. I think he is a real champion of the people. And every time I hear him talk about things, he has a vast, realistic, honest medical understanding of these topics. And, you can see from everything that's going on now, everything that's going on with crazy money being thrown all over the place in horrendous fashion, that we were told and were given this crazy discussion about what you have to do and should or shouldn't do, and it may not have been to our best interest. I'm not even going to mention informed consent, because so much of what is told and done and we're supposed to do has never been done with appropriate informed consent, so every person can have a decision with the right information as to what they should or shouldn't do. I think that the powers that be don't like hearing what he has to say, but, what he says is true. You cannot argue with certain statistics. When I was a kid and you only had a few injections, there was no ASD, no spectrum issues, and over time, all of a sudden, the statistics have gone crazy with the number of cases that are developing and have developed. And I think there's direct correlation. Some people do and some people don't believe that, but the number of injections being used now, and you can look up online, are just staggering. Why are there 50, 60, 70 things being done? It defies reason. So I like what he says. I like what he does. I like his steadfastness. I would love to interview him. Now, that would be a really long program because I would just talk to him about a bunch of different things, let him go on. I mean, I would love to have him on the podcast if anybody knows him. And we're trying to find out people that know him. So we have a few friends that might be able to reach out. But yeah, I mean, that would be an amazing, amazing thing. So stay tuned. You never know.
Stay tuned. TikToker. Not a medical question for me, but I've been interested in this podcast. Oh. Dr. Calapai, what's your best stem cell therapy patient success story? Oh, that's an interesting one.
Best?
It's going through a few years.
So when we do stem for joints and people can do well, and one gentleman had bad hips and we got him back to doing jiu-jitsu, he won a tournament, that's cool. Is it the best story? No, because it didn't change his life, radically. It helped him get back to fighting, which is important. And people that have had COPD where we've done the IV and the nebulizer that, can walk and function and go shopping and go up and down stairs and not use nebulizers, that's great. For people that have become non-diabetic over the course of a few months, that's pretty great. But besides that, the idea of someone becoming non-diabetic and sugar stability now is occurring where it hadn't for years, that person's not going to end up with all the diabetic damage to nerves and blood vessels and heart and eyes and brain and everywhere. That's a really cool thing. So I love that. I really love the patients who've had stroke that we've done STEM that can get back to normal talking, function, brain ability, going out to do activity and exercise. There's a lovely woman on the website, Janice, and we did her STEM a while back, a few years ago, and she was falling down all the time. Neurologically, it was just a sad scenario. But then after the STEM, a couple of months afterwards, she's up, moving around, going here, there, back and forth, traveling to Europe. She painted her garage and part of her house. Planted her garden. She never could do that before. That's a really great one. MS and Parkinson's patients. A Parkinson's patient was in a wheelchair, and the day or so after he did the STEM, his color vision became vivid. And he called the office. He couldn't believe it. But similar to the MS patient, he was out of the wheelchair within about a month. So those are pretty spectacular. So those are some of my favorite, where you take an individual whose life has been really dramatically changed and make it into a really functional life. And there's a couple more. We had a gentleman, Tom, from Nova Scotia on, and this is one of my favorite cases, one of my favorite patients. Sweetheart of a guy. He went through hell and back with severe cluster headaches, suicide headaches. And we showed pictures of him having the implants done in his brain. He went through hell. It was miserable for a very long period of time. When he came to us, because he's friends with a guy that I know, Mike or Bubbles from the comedy team in Canada. I forget their name. It'll come to me in a minute. A terrific group, a comedy team in Canada. If anybody knows, it's Rob and Paul, JP, and Mike, who they call Bubbles. At any rate, Mike called me and said, hey, we got to get my buddy in, blah, blah, blah. Send him down, got him all set. Within the same day.
Trailer Park
Boys. Yep. Yeah. Okay.
Love it.
All right. Yeah, so great guys. And his recovery's been remarkable. And he's 5 or 6 years out now and has had no more cluster headaches, and his life is completely different and back to normal. He went from being non-functional to perfectly functional. I follow him on Instagram and I think TikTok. Chinwag Barbershop is the name of his shop. And, he puts up a lot of funny stuff. But, yeah, his life is back to normal, and his wife and he are just, they're happy as can be. The other gentleman that we had on the show, a veteran who's blown up in a vehicle who wasn't functional at all, was bounced around to all the different VA facilities when we did his procedure. Same day we did it, some of his headaches and neck pain went away and got better and better and better. And he graduated. I think he went to 4 years of law school, graduated law school. And now he and I are working together to try to get more veterans and get coverage from the organizations that be to get veterans covered in similar, traumatic brain injury for stem cell. So, Josh, great people. So, yeah, every one of them that we've done is a wonderful thing. But when you radically change someone's life, and I mean radically, there's nothing more enjoyable. It warms the heart than that. Nothing.
Yeah, crazy. So we have one from Instagram. Dr. C, I'm going to be 62, and all of a sudden my feet have started to notice. My feet have started to notice the bottom of my feet have become calloused. What could it possibly be a sign of? I don't think it's a stem cell question. Okay.
Yeah, it may not be a stem cell question, but over 62 years walking around and doing everything you've done on your feet, it's going to cause wear and tear. So some people, their skin is a little bit more sensitive. Some people develop more calluses. Of course, I've known people that work in salons and stuff, and I know women will go in and get their pedicures and massage, and they scrub your feet, and they have this funny-looking thing, and they sell them, on TV, where it just kind of grinds down that dead skin for the callus and tries to make that skin, repair and heal again. Some people will do a variety of different things to try to keep their skin soft. We'll put some lotions or creams on. So if it's not a significant medical diagnostic problem, that you might want to see a dermatologist for, then sometimes just doing some of these simple, procedures, can work well. I dated a girl who did all that stuff, and I remember she setting up my house like, and I'm very, very secure on my masculinity, was setting my house up like a spa. And I sat there, and my dog's looking at me like, hey, pal. And she did my hand thing and massaged it and this and that. And, did the whole thing. I'm like, it's great. I wouldn't let her buff it and make it shiny because I, didn't need that. And then the foot massage part and the rest, was just amazing. My feet never felt so good. So, of course, I did whatever I could to make her happy and take her out and go here and there and vacations. And, of course, I wanted her to keep doing, my foot massage. So it's a great thing. Yeah, you might want to look into that and see if someone could take a look at that and see if you need to have that done. That might work.
Oh, that's funny. Yeah, I had that moment when I finally agreed with my wife. I'm like, okay, I'll go with you. I'll go with you.
I'm telling
and then
you,
you're like, oh my gosh.
it's
this
the
is
world's
best.
best kept secret.
Yeah, it is.
And then subsequently, I've gone and I go on vacation. You get a total body massage and this and that. But it's an amazing thing. No wonder women go every week. I should have, opened up a place like that, a nail, manicure, pedicure, massage place, because they're packed.
It's not too late.
And so Tuesday night, my friends and I go to a karate school on New Hyde Park Road, New Generation Karate, amazing school, great guys, all black belt class, and we beat the crap out of each other because that's what you do in a full contact fight class. And, the next day I'm either achy or sore or this or that hurts in my back. And, you rotate out of position and there's a place not far from where I live and I'll go and they have a chair massage. I'll go there and get a chair massage and massage your neck and your arms and your shoulders and your hands and your back. It's just amazing, whole new world. So I'm a big fan of that. I tell patients, go get massage whenever you can just to keep your muscles stretched, keep the blood flow going. When you do massage, you're getting rid of waste products of metabolism in your muscles. So whether you go for the full massage or you go for the chair massage, do it. There are a lot of techniques that are great.
Boom. All right. First question, by the way, we're on Rumble. First time. We're
Awesome,
on
Rumble.
Yeah, we're on our
new
personal
favorite
page.
group of people.
Yes.
We had a crazy response last Saturday on Rumble. I'm sure we'll have one tomorrow.
Yeah, we will.
But we like everybody. Our Reddit people are really awesome. Our TikTokers, our Instagrammers, and now the Rumblers.
The Rumblers. Here we go. So, hey, doctor, I am 58 and I've been waking up with stiff joints, especially in my fingers. It loosens up after a while, but I'm wondering, could that be early arthritis or is this just normal aging? What do we think?
Could be the beginnings of inflammation that we could describe as one of the types of arthritis. So arthritis is, as much as people think, it's a singular comment than a term. Arthritis is this, joint issues. The definition of the word arthritis is inflammation of the joint, arthro, joint, itis, inflammation. But there are different things that can create that. It could be, and one of the most common mechanisms is wear and tear on ligaments, tendons, cartilage, connective tissue, and your body's being irritated or inflamed. Less often, although significant, would be osteoarthritis, where you have bone change. Rheumatoid is an autoimmune mechanism that can cause inflammation because your body's attacking itself. Some people have infection that can contribute to arthritis, and the prototypical infection is Lyme disease. So there are a variety of different things that can correlate with that. Yet other people, I've seen vitamin deficiency correlate with that. Some people that have very low levels of B6, once you put the B6 on board, they say, wow, I feel better. Or some people think their hand is getting stuck in a weird position, almost like they have to move the hand, and that could be magnesium, potassium, or calcium deficiency. Hormone decline can correlate with that. So I'd like to figure out what the underlying causes are, and then we can put, recommendations together for that. Some people will have them stretch or use a heating pad before they go to bed. Other people will do exercises and stretch first thing in the morning while they're still in bed to try to get their body, starting to move. But depends on what we find. And the blood test is really important for that.
Okay, we got a TikToker, 29, feels like he gets sick more often than other people. Every few months, I catch a cold, even though I eat well and take vitamins. Could my immune system be weaker than normal?
It could be. So just eating well and taking vitamins, although that seems to be it's a good comment, we need to see what your vitamin levels are, because some people take vitamin D and they think, 500 units is a lot. It's not. Most people we have taking 5,000 units of vitamin D once a day, and those people typically fall into a great range between 80 to 100 on your blood test. Now, the blood test shows you should be between 30 to 100, but you don't really start getting the great results from vitamin D unless it gets up into that 80, 90 range. So if you bring that up and your immune response does better, your mood's good, your bones are stronger, that may be an important correction for you. And similarly for vitamin C, B6, zinc, they're also good for your immune response. So maybe your immune response is not doing as well because the nutrients aren't there to do that. For some people, hormone decline correlates with that. Other people, they're not doing enough exercise to really flood their cells with oxygen, vitamins, minerals, and hormones to create the best response from all their cells. Some people have allergy, and their immune time is spent dealing with allergy, trees, grasses, weeds, molds, foods. Those people can tend to have more issues with recurrent infections. And as I'm running through the 2 or 3 brain cells in my head, I'm trying to get them to communicate. As I'm running through ideas in my head, we've had, and I say this a lot to patients, over all the years I've been in practice, since 1988, we've done vitamin IVs for people because they work well to make your immune system strong. This research shows that they quadruple your killer cells, they stop free radicals, they decrease inflammation, good for collagen, a long list of benefits from vitamin C IVs. If you want to look at Google Scholar and look at vitamin C IVs, depending upon the time of day you look, you may get between 1,500,000 and 700,000 studies if you put intravenous vitamin C in the search box. It'll show you vitamin C IVs helping to inhibit cancer, using them with other medications. Vitamin C helping to inhibit viruses, including COVID, Epstein-Barr, shingles, etc. So there's a lot of literature on that over many years. And some people that I've seen will come in with a bug or a cold or a flu, and they'll do a couple of IVs once or twice a week for a couple of weeks, knock it out, feel great. They'll also, when they start to get a cold, will do that, and some will do once or twice a month throughout the winter, and they say they don't get those colds anymore. So, and it's a substantial number of people that don't get that sinus infection, the gut problem. They don't get their colds because they're keeping their immune system at a better level. So that's a pretty significant thing. So once we figure out what your issues are behind the scenes, as we correct that, then you start to see the problems go away. But that's pretty common.
All right, what else we got?
888-420-9272. 888-420-9272. We have a couple of emails from the website. Tina is asking about hormone decline and anxiety. So absolutely, positively. So there are people whose hormones fluctuate, and women, of course, in and around the time of their period can develop anxiety from a decline in the hormones. For men, if testosterone drops, that can occur. For men and women who do a lot of exercise and activity, marathon runners, cyclists and all that, you're burning up and using up your hormones, so you're kind of putting yourself into a depleted state, and that may correlate with, anxiety, irritability, and just loss of, desire to get up and go. So, yeah, your body's meant to have these things, and when you get to an age, which could be your 40s, 50s, 60s, etc., where these hormones are dropping and staying down, anxiety, irritability, and panic, depression can occur. If someone presents and says, I have anxiety, well, of course, we'll look at the hormones, but we also look at your diet. If you're having too much carb and your blood sugar goes up and you feel good, you dump insulin, you crash, that's where you're going to have anxiety, irritability, panic, and such. So, and the hormones, we look at the entire hormone picture, 12-part thyroid panel, IGF-1, DHEA, estrogen, progesterone, all of that, testosterone. So we can gather a real good picture as to why it's there.
Not a question, but YouTuber says, non-medical question, but a lot of famous actors are actually starting to get stem cell therapy together. William Shatner actually speaks about it. So
yeah, William Shatner. There's
Finally.
An iconic guy.
Yeah.
So, who doesn't love William Shatner? Now, you might say his acting is campy, or it's a little bit over the top, but, you got to kind of thank him for that role, Captain Kirk, back in the 60s. When did Star Trek start? Because that created a whole, I could say world, but I'll say universe of all the science fiction stuff that followed afterwards. And I remember going to a conference out in Vegas, and he was going to be the headliner of the conference. And I was like, my God, Jim, my God, I have to go there and I have to meet him. Of course, I set up to go and blah, blah, blah. And I went to the conference anyway, but he wasn't able to make it. I think he was sick. But he's well into his 80s, I imagine, right?
Looks great.
He looks great, and he's a character. He's still funny. And he can parody himself. He's cool with that, and it's just really funny. And I see little bits that he does, and I watch his Instagram and such. He's got a great sense of humor, and he did on that legal show, Boston Legal. Is that it? Mm. But great character. He's got a lot of cool things going on in his life, loves horses and stuff. So, yeah, he's cool to follow. And certainly, yeah, stem cells, as soon as people understand what it really does and makes brand new cells wherever you have damage, then everybody understands it and gets on board with it. And a lot of the older people, the actors certainly, people who had lost function. So it becomes a great discussion. And I talk about it because people ask me about it every day. No matter where I go, I'll be out to dinner with some friends, and one of their friends says, oh, I've heard about you, or I've seen your podcast, I saw your commercials, I used to listen to your radio show. It's just everybody now wants to know how to feel healthy and strong. Of course, more recently, problems that people have all exposed or been exposed to or experienced, and significant lingering issues, people want to get healthy and strong again and not lose their ability to do their daily activities. So absolutely, put it all together. As good as one technique can be or one thing can be, if you put the best diet, vitamins, minerals, based upon your blood test, based upon that proof, exercise, all of this, STEM, you get your greatest result. Once again, 888-420-9272. If you'd like to call in to ask a question, we can hang out as long as you want, really. I mean, Frankie, you busy after this? I mean, we'll be here to take your calls. We won't do it forever, but we'll be here. Another email question from Kelly about food allergy. She has some skin changes, issues with her hair, some anxiety. So the interesting thing, and I've done this for a really long time, when we test to look at allergy and we find through skin testing, and we do blood as a screening for allergy just because it's quick and simple, but the skin testing for allergy, intradermal testing on the upper arm, will tell us exactly what your body's reacting to. We take those foods out and watch to see things improve. And in many, many, many thousands of patients over 39 years of this, people will always add something else on board that they didn't think may have been related. And I may have not thought to be related, but this is how we learn the total, understanding of what allergy can do. And yes, there are women that have problems with their skin, and you take out that food or you take out the chemicals that are in that food, and all of a sudden skin clears up. It happens to, men as well. And for some people, bloating and digestion goes away, headaches go away, brain fog goes away. So there's a lot that happens. And when I was talking about the gut and psychological mechanism, there are different mediators, corticotropin releasing factor, that can affect your brain from what's happening in your gut and vice versa. So the idea is you want to make sure you're not constantly putting things into your body and into your gut that'll create inflammation and set off this cascade of problems and make you uncomfortable, make you unhappy, affect your skin, your function in many ways. So that's why we look at that and talk about that to patients all the time.
Got a Redditor here. Said, "Hey doc, I've been getting night sweats lately. Even when my room is cool, I don't feel sick, but it's happening more often. Could this be hormone related? What do you think?"
Could be hormone related, especially in people that are beyond their 30s, et cetera.
Said I'm 40.
Yeah, 40s. Hormone decline correlates with that. For men, it's usually testosterone decline. For women, could be DHEA, estrogen, progesterone decline. So lately, in the past bunch of years, hormones are lower than they were in the 50s and 60s. And research has described this. And it's curious, but not that much of a surprise to me, because I've seen a lot of literature talking about the plastics and bisphenol A affecting hormone production, all sorts of chemicals in foods, et cetera, et cetera. So that's why over years and decades, our hormone levels are not what they used to be, and they're dropping sooner and dropping lower in earlier ages. So this is why I have this conversation with everybody. And even a person I might see tomorrow who feels a little bit off here or there, if their hormones are below the 20th percentile in that range of normal, in many cases we want to push them up to the 50th or the 75th percentile to see how much better they feel. That's art and science, put together. When your hormone levels were, at an 80 or 90 percentile in the normal range, you're doing great. When they keep dropping down, you don't have to wait until they go way below out of the range to say, hey, something's happening. And then with most patients, I have them bring in prior blood work so I can see where their levels were over the past few years. And you can say, look, you've been dropping your hormones for the past 5 to 7 years. That's why this is accumulating and why you're feeling worse. And then evidence by correcting that, and they get better. So, yeah, it could be a variety of things. Sometimes infection will do that too.
All right, we have Instagram. It's not exactly a question. It just says, I love your show. So informative. I learned something from every question.
Oh, awesome.
We love it.
Thank you so much. That's what I'm here for. Very happy to hear that. Yeah, I want to have an army of people telling everybody else to listen and learn and, get themselves super healthy. That's what we would love to do. All righty. Who do we have there?
Oh, hi. Is it me?
Yes, sir.
Oh, hi. My name's Tom. I'm calling in from Florida.
How are you, Tom?
I'm doing quite well, actually. Quite well. And how are you doing today as well? I love your soup, by the way.
Oh, thank you. Yep.
Yeah.
You got to jazz it up every now and then, I like nice colors.
I'll be honest with you. I'm involved in a community or whatever where your suit would be very popular, and I'll come out and say it. I'll be honest with you. I'm part of the pineapple lifestyle, the swingers community.
Okay.
Yeah, and just to say that I'm not saying that I'm just saying in the clubs and stuff, I've seen an awful lot of older gentlemen who look like you, and that's a compliment.
Okay, I'm not sure how to take that, but
I have a question for you.
Yes.
And that is, I don't know if you have expertise in this. Do you know what the AMS 700 is?
No.
It's a penis pump, and basically for erectile dysfunction, and it is the next step after taking injections. So you would take the
injectable product, yeah.
Yeah, so that's the next step after Viagra. There's high dose Viagra, then there's the injections, and then after that, if it still won't work and you still want to get at it, then you do this implant where you physically pump it up every time you want to make love. Yeah, exactly. And my question for you is: do you think that if somebody in my situation, who the world and everything, and that my surrounding everybody's telling me you need to stop making love, do you think that if I put this implant in to continue making love, even though I'm not supposed to, do you think that I am spitting in the face of God and that I am doing something disrespectful to the world around me?
I don't know that if you do that to correct a dysfunction, that would be a bad thing.
But,
and a lot of people have done it.
But isn't it yeah, I guess, but what if mine stopped working because I used it too much? And maybe it's like God's trying to say, hey, you're all done. Stop using it. And
I could never imagine to think of what God would or wouldn't say. But
I just think to myself that it's kind of like, maybe because the injection stopped working, maybe it means that it's all done for me and I pack it in. And Lord knows I put in a 25-year career in a shorter period of time, if you know what I'm saying. I kind of
understand what you're saying. So yeah, it's an interesting.
You wouldn't have an issue with that. You wouldn't see that's disrespectful to God.
You can think that we're put on the planet to have a specific existence, and just like other people that have other issues that need some care, whether it's a medication or a surgical procedure, et cetera, to help to normalize function, I think as long as you're doing the right thing with people that you're with, I don't see that as being an issue. And, I'm sure God is ultimately and phenomenally forgiving, but, and certainly you can speak to your religious, leader about that if you have someone you can speak to on a private level, and whether they do or
he doesn't really. I got to keep those two worlds separate a little bit. But
so
I appreciate that thoughtful response from you, and thoughtful response to your thoughtful guy. I got to say, your show looks fantastic as well. Like the video quality of it, and the setup that you have.
That's Frankie. Frankie is the pro there. He does this like no one else. And he makes it look good.
You got it going on, my friend. I'm not joking. This is it's better quality lighting, and the sound is fantastic. I mean, I got a friend named Terry, tech head, who could talk your ear off about this stuff. But this is genuinely, I will say this, you guys seem fantastic and kind, and this is one of the best video and audio setups I've ever seen on this type of thing. So thanks so much for your time. You guys have a good day.
Thank you for your call.
Bye.
Great call. As I say, we love to get calls from everybody about any topic, so it's very, very nice to hear from everybody, and certainly from him. That was a great call. Everybody has ideas and needs and thoughts, and I think they need to be addressed. And as a physician, you have to help people, in some cases, make decisions as to what they can do to improve their life and their conditions. So physicians can never be judgmental about what they should or shouldn't say to patients. And, you want to give people the best recommendations or suggestions as possible. And, I think people that have spirituality in their life, it's a great thing in many, many ways. I certainly do, and everybody that I know does. And so it's important to have that thought. And about spirituality, I think being spiritual or being religious, it keeps you in a great moral compass. And someone else said this once, and I thought that term was really awesome, a moral compass. You're moral because you want to do the right thing for other people. You want to do the right thing in the eyes of God. So, and there are some people who may not be religious who don't want to know or hear about that, but that's fine too. You can kind of be wherever you want. But I like that term, moral compass. And I like the idea that people would think, maybe I shouldn't do that because, God may or may not like that. It just gives that person that extra thought about the world. So I think that's a nice way to think. Okay, anybody else?
That's it for now.
Okay,
that was a good ending. I think that was a beautiful. That was a.
Should we end on that call?
That was a new one. Yeah,
that was a good call. About the jacket, I love really nice clothes, and when I was in college, I'll tell an interesting story. I worked at a store in Roosevelt Field when I had just gotten into college. It was called Clappers back in the day, and it was a very, very nice but very expensive clothing store. I was 18. And this goes back to 78, 79 or so. And there were a lot of people that came into that store that were wealthy back in that day. And I first started, fixing the shelves and helping the gentleman, do the ironing for the display in the windows of the store. And then I got good at, talking about clothing, and I learned a lot, and I would sell sportswear. Then I got to sell suits and all the expensive stuff, and I was good at it. I made like 8% commission on everything I sold. And a story that I can't go in too deep into depth to, and my friends and family know this story, but there are people that I would meet when I would go out with my friends to dinner in nightclubs. One group of people I met, I thought they were in construction. They were well beyond that. And they liked me, and they would come in and buy lots and lots of stuff from me. At one point, some of these famous people, one of them died a couple of years ago, he was over 100, would come in and spend $30,000 buying suits, and I would do the ties, the jackets, the pocket square, the belt. I did everything. And the guys that owned the store, they loved the fact that I was selling so much. And of course, as an 18, 19, 20-year-old kid, I was making money that I never expected in my whole life. And, you got to have a little bit of a flair with it. Long story short, the general manager came in, and these guys come in. They were kind of gruff and scary looking. They asked for me, and general manager said, "Is everything okay?" Because, he knew who they were. I didn't know. I thought construction was construction, but these were beyond that. So the general manager took me to lunch, told me who they were, and I freaked out because I didn't know anything about that. And I said, wow, my parents are going to kill me if they find out. Of course, I don't think they ever found out, unless my mom, of course, is listening to the program now. But it was a nice place to work. I met a lot of nice people. Of course, I never saw those people as I got into medical school and got into my career. But it was nice to learn how to look good and to dress well. And when I had my office in the city, when I first started in practice in the late 80s and 90s, I used to wear sport jackets to work and, I would just dress up all the time because that was the thing to do. And back when Armani was really Armani and the suits were gorgeous. You remember that the movie American Gigolo with Richard Gere, et cetera? Clothing was really beautiful back then. Not that it's not today, but it was a great time to dress up. And I just enjoyed it so much. And that just kind of carries through with you over time. So my friends that all went into banking, would all wear blue and black suits with red ties and blue ties, which I couldn't stand. It was just like you're wearing this uniform. And I'd meet with them in the city for dinner, and I'd be wearing beautiful outfits and colors and this and that, and they'd be wearing all the same, red ties and blue ties and black and blue suits. At any rate, it's just an extension of your desire for creativity with color and, wearing something enjoyable. So I change my jacket and suits every time I come here. So although people don't wear suits and sport jackets that much anymore, I still do. And I like to do it for the show. So thank you for enjoying the jacket and the color. We'll be soon to show you more and more. Okay, 80 minutes. Thank you so much for listening to the program. God bless you all. Thank you for your calls. Have a wonderful day. Certainly, as a favor to us, be sure to like and follow and subscribe and whatever you're supposed to do. Send this to your friends so everybody can see it. We're here to do this every Monday and Friday, 12:30 onward. And tomorrow we'll be here at 2:30, and we have our big Rumble following tomorrow. So very excited to see how that turns out. We had a crazy response from our first, and not a really planned or projected audience. We just kind of went on, and we had a lot of calls and a huge amount of followers from last Saturday. So this is what I will be doing going forward. And we love to do it, right, Frank?
Oh, yeah.
And Sabrina's not here today, and Louie's not here today, but
Tomorrow.
we held the fort down, but they will be here tomorrow. I guarantee that. And we'll have another wonderful time.